All right, so hello everybody. I have here Dr.
Munaba
Munaba
Nasiiro.
Nasiiro, right out of Marigot, right?
Yes.
And a past student of mine, St. Andrews, Marigot, Dominica. And she is in a field, a profession which I have practically no knowledge of.
I'm
So-
gonna tell you.
But by the end of this, we should know a little bit about it. So I want Manaba to introduce herself and tell us just a little bit about herself, and then we'll go into the tell us about the profession of chiropractor. What is it? Chiropractor.
The term is chiropractic.
All right, chiropractic. All right. So Manaba, tell us just a little bit about you and your background.
So my background is education-wise. I have a bachelor's degree in biology and psychology and a minor in chemistry and a doctorate degree in chiropractic. So I am a licensed chiropractor.
All right. A licensed chiropractor. So Manaba, what a chiropractor does.
So there are many subspecialties under the chiropractic umbrella, but the basic premise behind the field of chiropractic is making sure that the nerves are not being irritated. So different things can happen. The way I like to explain it is if you have the push and the pull on your joints being equal, forward, front and back, left and right, then your joint will be able to move free. Like look at my wrist, it's moving. But if I held the back of my wrist and I tried to move it, it wouldn't move so freely. It would be irritated because my joint is being restricted in the back part of my wrist. So as a chiropractor, our job is to make sure that the push and the pull, left and right, front and back is even. And what that does is make sure that the joint is able to do what it's supposed to do, move freely with as little irritation as possible. If there is some irritation, let's say maybe there's a muscle that is weak, or maybe there's a muscle that is overreactive, maybe a little bit tight, maybe a little bit too strong, you're not going to have a good balance. And that can cause maybe some joint discomfort. Maybe the nerve is irritated, maybe the joint is swollen, maybe there needs to be some strengthening, or maybe there is something that's causing an imbalance. And as a chiropractor, it's my job to find out, well, is it the muscles? Is one muscle not doing their job? Is one muscle too strong or too weak? Or maybe the joint, maybe there's some restriction from the joint itself. Maybe the joint is misaligned. Or maybe there is something going on within the joint that is something that shouldn't be there. And so my job is to make sure that the joint is moving in the correct way. And usually, if the joint is moving correctly, we're able to make sure that the joint is not irritated and there's less discomfort.
So, in growing up, even at my age, in my 50s, I've never been to a chiropractor. Though, like we normally visit a regular general practitioner, medical doctor, do you recommend that at some point in our life, should we have an appointment with a chiropractor?
It's great to get checked. There are many things that can cause discomfort, and there's many things that can put stress on the joints of the spine. For example, I look at my kids, they love to carry their backpack on one shoulder. That's not balanced. You do that for quite a few days and you may be able to tell the difference, from one side to the next. Sometimes there's stresses being placed on our bodies. I remember when I was pregnant, I had a whole bunch of weight in front pulling on my back, and my back was pretty sore. Not because I did anything wrong, but because my body was a lot more stressed in the front compared to the back being pregnant.
So after pregnancy, is it recommended that after someone has a child, a woman has a child, that she see a chiropractor?
Well, when I was pregnant, I was seen by a chiropractor
Oh, while
throughout
you were
my
pregnant.
pregnancy.
Okay.
Yes. And it was very helpful. because I was able to be a lot more comfortable than I would have been without seeing a chiropractor. I was able to make sure that my joints were moving properly, and that there was a lot less stress being placed on the muscles and the joints of my spine. So we think about, the joints of the back and the neck, but there are many other joints. There are joints of the feet, joints of the ankle, the knees, the hips, the wrists that also can be helped by a chiropractor.
Where are the typical most problematic areas are where? I have an idea, but maybe
There's so many joints. There are lots of joints in the spine, and they're usually in quite a compact area. And so we'll think about, a lot of the times we'll think about a chiropractor taking care of the back or the mid back or the low back or the neck. But many chiropractors do also work on extremities like arms and legs, joints, wrists, the joints of the jaw. Those are all joints that chiropractors are able to help with.
Okay. So when I always hear people talking about go to the chiropractor to crack your back. What does that mean?
That's a good question. So some chiropractic techniques do create a little bit of a sound that sounds like a pop or a crack or a click. But not all chiropractic techniques do. When I was in chiropractic school 20 years ago, there were about 108 different chiropractic techniques. And they all work a little differently. Some may give you some cracking sounds, and some may not. Some may just look like we're working on the joints, maybe doing a little bit of what might look like a massage. But all the techniques work to make sure that there is more balance within the body system, so the body is under less stress.
That is quite interesting because I had no idea what a chiropractor. And to study that for all these years, just to study about many joints, right?
Well, it's a lot more than just joints. Our schooling, when I was in chiropractic school, we had to do a lot of anatomy. We did human cadaver dissections. That's how I learned what joints were connected by actually doing human cadaver dissections. And that was, very eye-opening. It would be similar to what a medical doctor would do in terms of their dissecting techniques for a study.
So you have to go through the same, at least in the initial basic training of a medical doctor, and then you branch out to that specialty?
Chiropractic training is usually just from a chiropractic school. But
Okay.
yes, some of the anatomy and physiology that we would learn would be similar.
All right. So if someone wants to get into chiropractic, what are some of the prerequisites to get into there?
Different states have different licensing requirements, but a lot of states now are requiring you to have a bachelor's degree before you're able to get a chiropractic degree.
Okay. A bachelor degree in what subject?
In something like biology or health science related. I thought it was helpful to have a degree in case I changed my mind, and so I decided to do a bachelor's degree before I came to chiropractic school. But I think it's helpful to at least have your feet wet within the sciences and the health science field.
So maybe I have to go back on that, but what got you into chiropractic? Because it's not a common thing in Dominica where we're from. What got you into it?
I did not know anything about chiropractic before I started my undergraduate degree. And when I found out about chiropractic, I realized that there were all these chiropractic doors around me.
Wow.
There was a friend of mine who was seeing a chiropractor. There was another friend whose sister and fiance were both at chiropractic school, and there was a person who worked in the admissions office whose husband was a chiropractor, and I was able to shadow and they were able to help me make a decision on my chiropractic journey in the initial stages.
Wonderful. So is there a demand for that kind of field? Just say you got into it, you think is I guess you like it.
I love it.
You love it. All right, good. That's good. So is there a demand for that practice a lot still?
Well, there are people. There are people who will hurt themselves, by the jobs that they do. Some people do very demanding jobs that are quite repetitive. Let's say a factory worker who would work on an assembly line, they do the same thing repetitively over and over again. There are people that love sports that will do things that will put their bodies out of balance. And there are people that have bad habits, like how they hold their phone or how they sleep.
Even though they hold
their
the phone.
posture. absolutely how they hold
Oh,
their
you mean with
pose.
your neck issue?
Absolutely.
Ah.
There's a lot of stress on their necks.
So give us some advice on good practices.
So one of the advice or things I would advise you on is to make sure that you keep moving and that you don't hold your body in one position for an extended period of time. Having a variety, having some where you're doing many different things is usually better than being stuck in one position all day long.
Oh, wonderful. Thank you. But another thing, I remember when I saw you several years ago, you were also doing that acupuncture thing. Do you practice it or
I
you?
do.
Wow.
I do. I'm trained as a chiropractor who also does acupuncture.
So tell us a little bit about acupuncture then.
Acupuncture is a very old healing art. It's another way that we can use to help take stress off of the body. And when you say stress, it's just another way of saying that your body is out of balance. So it's trying to make sure that your body is able to communicate and able to not put more stress in an area where it's not necessary.
Okay. Wow.
So acupuncture uses very fine needles to help balance the acupuncture or the chi energy flow within the body.
Tell me a little bit about that chi energy and those needles and how I'm a science guy. I always had the fact about how does that work? What's the if you're gonna get too complicated, you don't have to.
It's not too
what is the whole mechanism behind this acupuncture?
So
thing?
acupuncture, when you think about from a science perspective, if you think about that our body has many different systems and many different channels or pathways of things that travel throughout our body. For example, our respiratory system, air travels throughout our body. Oxygen, there's an exchange between the cells of oxygen in the circulatory system. There's also the lymphatic system. There is where blood travels through our system. And if any of those pathways are blocked so that you're not able to have that flow, then you're going to have some problems. For example, let's use my wrist again. If I put an elastic band around my wrist, after a little while, my hand would start feeling numb. There wouldn't be able to be enough blood flow to my fingers. My fingers might start feeling cold. And the balance will not be there. The energy that's supposed to travel to my fingers is going to be blocked. And so if we're able to adjust and to make some modifications, the simplest modification would be to take the elastic band away, but maybe it's in an area where we're not able to do that. And so we're able to use very fine needles to help alter the flow of the chi and help the organs and organ systems be more in balance.
Man, that's some interesting stuff.
It
really,
is.
really interesting stuff. I gotta get through all the. But so I wouldn't make it gone for too long. But I would just say, what about go back to the chiropractic thing? How important are our shoes? Because you keep talking about balance, and I'm thinking about maybe that's where we interact with the ground. That may be one of the most important parts.
That's another way of balance. A lot of our shoes are designed so our feet aren't flat. If you look at a lot of tennis shoes, they're skewed. A lot of shoes are a lot higher in the heel, pushing our body forward. A lot of our shoes don't even move. If you try to flex your shoe, sometimes you can't even get them to bend. And our feet, they're meant to move. Those joints in our feet are meant to be flexible. We're meant to have arches. We're meant to have joints that move and help to support and to help pump the fluids within our body. And so if our feet are not functioning the way they're supposed to, then that starts a whole chain. Our feet aren't moving the way they're supposed to. Our ankle's not moving the way it's supposed to. That stresses the knee and the hip, can stress the way our pelvis moves. And that can start a whole chain getting off balance. So yes, if our feet aren't strong enough or doing what they're supposed to because of our shoes, that can affect our whole body.
Wow. Interesting. All right, well, Dr. Nasiiro, I will maybe just give you an opportunity to maybe say something maybe that you wanted to say that was interesting and maybe I never asked because I had no knowledge to ask. Just tell us about and we can just wrap it up.
To wrap it up, I would say it's easier to keep something in motion. It's easier to keep your body healthy rather than trying to fix it after it's broken. So keep your body healthy. If you're healthy right now, keep moving, keep staying that way, and you'll find your body will treat you a lot better than waiting until it's broken.
Wonderful. Well, I want to say thank you. This was a very impromptu thing. As you hear, we in this place, we have some background noise, but I think we got a very good, at least a good summary of those two, acupuncture and chiropractic. And thank you so much, Dr. Nasiiro. Appreciate
Welcome.
it. Bye-bye.
Check the method, lesson one, a verbal injection for the minds in my section, the source of perfection. Forget the block talk, this is mental elevation. My whole